All right, thanks, Brett. Hi, everybody. You should be seeing the MySafeStart data. As you can see, all of our counties are still in the E risk level. Our cases per million increased, but not as big of a jump as we have been seeing. And our percent positivity actually decreased slightly to 20%, with testing trends being downward as of April 13th in most of our counties. So that's a little bit surprising since the school sports are required to do daily testing, I believe. So curious to see if that was a result of spring break when this is updated next week. Our daily cases per million is still over 300 in each county, but most counties are seeing a downward weekly trend besides Manistee, Newaygo, and Oceana. We have actually seen a 13% decrease in cases when comparing this week's cases to last week, so that's some great news for us. The cases we saw in the past week were identified as household and community contact, school, including colleges, and that sports testing and other sports team exposures, daycares, recent travel, religious services, social gathering, casino gathering, healthcare and care facility workers, and worksite exposures. Our total number of jurisdiction-wide cases yesterday was 17,398, and cases by county as of yesterday are Crawford with 848, Kalkaska 930, Lake 513, Manistee 1,018, Mason 1,744, Mecosta 2,669, with Ferris reporting 722 cases, Misaki 1,138, Newaygo 3,879, Oceana 2,343, and Wexford 2,316. And in the past week, there were 12 deaths reported and 486 people recovered. Yesterday, there were 13 positive inpatient cases at Munson Healthcare Cadillac, 6 at Munson Grayling, 5 at Munson Manistee, 15 at Spectrum Health Big Rapids, 14 at Spectrum Health Gerber Memorial, and 16 at Spectrum Health Ludington. So next we'll move on to our vaccine table here. So you can see that DHT-10 has administered just over 83,000 doses as of Sunday, April 18th. And in our 10 county jurisdiction, just over 69,000 people have completed their vaccine series. Are there any questions?
All right, I don't hear any, so thanks, Jordan. Now, Sarah, you want to provide an update?
Sure. I just wanted to share some of the conversations we've been having internally as it relates to vaccine hesitancy. We have pretty much kept up week by week since early February, roughly around 5,000 doses a week across the jurisdiction. And the last 2 weeks have been significantly less. With this week, I think we're projecting around 12 or 1,300 vaccinations. So definitely a huge increase. And that is true from the sounds of it across Michigan. It's not just us, it's our partners as well. And so we have been moving towards next week, instead of having 2 first dose clinics in every county, we're moving back to 1 first dose clinic in our office, and then taking an attempt to take the show on the road a little bit to do some targeted community clinics. So for example, next week in Oceana County on Wednesday, we are partnering with Double J Resort to provide a clinic there in Rothbury, targeting their employees' family, and then it is open to the public. And so that scheduling link is out on our website for any of you in the Oceana County area. Same for Manistee County. We are partnering with the Little River Band of Ottawa Indians to do a collaborative clinic there at the casino. And so that clinic is unique in that it will go until 7 p.m. And while we are promoting scheduling so that people have an appointment time, We have opened that up to a walk-in opportunity for people to show up and get vaccinated as long as they're willing to stand in line if need be. Hopefully going to hit 600 people or 300 people if you're Brett. That's his prediction. So we'll see where we go. Just doing a lot of marketing right now for that clinic. So if you know of people, send them to our website so we can promote those kind of mass clinics. And then in addition, we're looking at smaller venues as well. And so working with a number of employer manufacturers who've asked us to come in. We have one organization that has a plant in a couple different counties, and we're going to be doing some employee education as it relates to answering their questions around vaccine concerns. And then we'll be going on site and doing vaccine clinics for those organizations. In addition, we have a group of I'm going to call them interns. They're temporary employees. We're working on an outreach project for me, designing a 3 or 4 question survey that we'll share with this group, asking you to share that out to your networks to get input on why people are getting vaccinated, why they're not getting vaccinated, and ideas of where we should be maybe doing a little pop-up testing, or I'm sorry, pop-up clinics to get out into the community, out county, into the rural areas. So stay tuned for that information, and if you would please share that with your networks, we'd greatly appreciate it. The other thing that we have going on is we're working with some of our partners to secure funding, including our hospital partners, to secure funding to support the purchase of smaller freezers that will hold the Pfizer vaccine within each of our health department offices. So the last 3 months, we've been doing vaccine transport from Mecosta County to all of our counties in need of Pfizer. It's become very labor intensive and expensive from a transport perspective. So having these smaller, very much smaller freezers in each of our health departments will allow every county to have Pfizer vaccine, which we know we really need to move towards as the vaccine is going to open to a younger population who currently can only receive the Pfizer vaccine. So we're hoping that will help address parents' needs to get their kids vaccinated. The other thing that we're putting a plan together for, again, to address vaccine hesitancy is related to walk-in clinics. A lot of the bigger city health departments are doing walk-in clinics. Many of our pharmacies are doing walk-in clinics. We have hesitated to do that out of fear of wasting vaccine. We've been a pretty good record thus far of not having lost any doses of vaccine. So getting freezers in each of our counties will help us be able to do more walk-ins. We did move to our second dose clinics, which have been traditionally on Saturdays. We have moved those to Fridays starting this week in an effort to scale down the number of hours our staff are spending on weekends in clinic. And we're going to monitor how that goes for community. And I think that's probably all that's on my list, Brett, unless you see anything that I missed. And if anyone has ideas, because you are from a small community, or you recognize in your county that there's a small community that you think would benefit from a clinic to help reduce transportation barriers, please, you can email me directly or email through Brett, and we'll work with that community to get a clinic going.
Yeah, just 2 things I would add, Sarah. You touched on the 12 to 15-year-olds getting vaccinated. So that should, we're expecting that approval to come through shortly, next couple weeks, month or so. And then also another question that comes up a lot is what about J&J? And we've heard that could be as early as this weekend, but there really is no definitive answer for that as well. It could be another couple weeks for J&J as well. So those two things are in the works, and both of them more than likely will happen sometime in the next few weeks. And I think that's all I had to add, Sarah. So any questions on any of that? And so we'll take a couple minutes to hit on any of those, any clarifications on what Sarah talked about or Jordan. And then if not, we'll just open it up to the floor if there are any topics any of you would like to bring up. Jeff, go ahead. You're on mute if you're talking, Jeff.
I'm sorry, what's coming out of Lansing? Extension right now from the governor's office, I believe, is the May 24th, if I'm not mistaken. And there's discussion of taking some of these current guidelines and MIOSHA taking and running with them. I don't know if you have any knowledge or can elaborate, please.
Yeah, honestly, I'm out of the loop on that one. So Sarah, Jordan, any information you can provide on that?
That was not discussed on Tuesday's call that I was on, but I believe the health officer call is tomorrow. So I can ask Kevin to shoot out an email or address it next week. Would that work?
Yeah, any update would be wonderful. Just there's, people have a life and gatherings planned, and they would like to have some direction, I'm sure, as opposed to the great unknowns. I mean, we always have the unknowns, but these seem to be popping up a lot over the last year, obviously, and it'd be nice to get some clarity.
Anyone else? All right, hearing none, I think that's all we have for you. So we'll plan on meeting again next week, same time. Have a good rest of the week and a good weekend, everybody.